Hi everyone, it's me, Lindsay, again with EquipMeOT, here today to talk about lower body dressing and more specifically how it pertains to recovering from a total hip replacement or other surgery that prevents you from safely bending forward to dress your lower body. So we're going to go over some equipment, we're going to go over some tips and tricks to make your life easier during that recovery process. So let's start right off by going over some very specific details about what types of clothing you should be picking if you're going to be recovering from a total hip replacement. So something really important to consider is when you leave the hospital, you want to make sure you have selected an outfit that is going to be easy to get on and comfortable for you to wear following that hip replacement surgery. You're going to have an open wound with likely staples and some glue, and they'll put a bandage over it. So you're going to want something that's a little bit looser fitting as it will accommodate some swelling. I like to choose either some athletic wear, like some nice loose shorts if it's summertime, or a really comfortable pair of standby sweatpants that are going to give you a good amount of space and comfort as you return home. These are also going to be the easiest for you to get on and off independently so that you're asking for less help, especially if you're planning on recovering alone. Another consideration is the type of sock you pick. Now, I always tell folks to plan on having some lower body swelling, and this could occur in both legs, not just your surgical leg. So make sure you select socks that have a nice, fairly loose, comfortable band that allows for a little bit of stretch. If you're going with a higher sock, I often recommend folks consider purchasing themselves, even if they're not somebody who has diabetes. There's a type of sock called a Diabetic Sock, which has a lot more give at the top to accommodate fluctuations and swelling in the legs. So a higher Diabetic Sock is going to prevent you from getting that painful cutoff that can occur at the calf. So that's an important consideration. The next thing to talk about is footwear. So I've selected a couple of my shoes here just to kind of give you an example. This right here is this is by Merrell. Skechers makes these. Pretty much all the major brands make this type of shoe now. They're nice and stretchy. There's no laces, so they're a slip-on shoe, but you still get a really solid sole, and it has a closed back. Some people will turn to a slide-on shoe because they're the easiest to get on and off, obviously. But as a therapist, I have to say I don't recommend using that type of shoe right off the bat because they tend to be more prone to losing balance or falls because your foot could slide off uncomfortably, especially if you have any numbness or tingling in your feet following your surgery. So a good closed shoe is a must. If you do want to use your traditional tennis shoe, you may, but I would highly consider transforming your shoes into a slip-on by purchasing a good set of elastic shoelaces, which simply replace your regular shoelace, and then you tie them and leave them in position in a spot that's comfortable to basically convert your tennis shoe into a slip-on shoe. So those are my recommendations for that. Obviously, another option would be to go with a Grippy Sock. This is very common in the hospital. They will give you those hospital-grade socks with the grippies on both sides. Those are a great option for in-home as well. But make sure when you're considering the shoe that you're going to wear to go back home after surgery that you take into consideration a good, sturdy sole. Okay, so let's go ahead and get into the equipment you're going to need. So the keys are going to be a sock aid. Okay, this is a standard sock aid. It's a one size fits most. They do come in a bariatric width in this solid body as well as a neoprene flexible one. All of them are going to work exactly the same as far as how they're used, and they are all about the same price. So these might come in your hip kit if you were given one pre-surgery. You're also going to need a long-handled shoe horn. I have two different types here. This one's actually a little shorter than I like. I like them to be closer to that 24-inch, even 32-inch, depending on your leg length and height, because again, you can't bend to reach down to get your foot, so you need a nice long one. This is a really neat product. This is actually a combination dressing stick and sock aid with a nice grippy rubber handle. This one's by Juvo, and I like this one a lot, so I'm going to demo this one in a minute. The other thing you're going to need is a good reacher. So I've got two different types here. This one is kind of a rubberized pincher reacher. It has an adjustable head. And this one's going to work pretty well for your dressing needs. This one you might get in a more traditional hip kit again. It's got that tight pincher grasp. It should work pretty well for getting your pants and underwear on. I have a third option to replace those reachers, and that is this really nifty, made by myself, clamp tool with a rope between it. I have a good video here that demonstrates how to make one of these and use those to get your pants on, and I'll link that here if you have any interest in that. This is a really good technique for folks who struggle with the reacher. I'm going to focus on the reacher for this video, but check this video out if you want more information on it. All right, so let's get started. The very first step to getting dressed is typically underwear. So when you're considering doing your dressing task, make sure you know how high up you're going to be, because you're going to be sitting and standing a couple times throughout the process. So select a surface that's easy for you to stand up from. You're going to need your reacher or your walker nearby as well, because that walker is going to provide you some physical support once you do stand up. I'm going to tilt it out of the way for visual reasons so you can see my legs, but typically it would be right in front of you throughout the process. So we're going to use these as a demonstration for underwear. You're going to use your reacher. I'm going to select this one as it's probably the most common. You need to put your pants over your surgical leg first, okay? So let's just pretend I had my right hip surgically repaired or replaced. I'm going to use the reacher to kind of go down gently over the foot. You put it over the waistband and simply guide it over that surgical leg, okay? I'm staying in a reclined position. Now my non-surgical leg, and we're going to go up as high as we can. Now, very important then when I go to stand, I don't bend forward. I'm still going to have to push up to keep that hip in a nice beyond 90-degree position. Stand up. Rest of the way up over your hips. All right, so one step on. You can avoid this step if you decide to go without underwear, which is entirely an option if you feel like that's an extra step that you can avoid. That's a really personal choice. So let's go with our sweatpants now. Long pants are always going to be a little bit harder to get on than the shorts. So if you can do shorts, or if you're a lady and you can do a dress or a nightgown or something like that, you're going to be in such an easy position for all your dressing needs because you won't have to worry about putting pants on. But for this purpose, let's switch it up. I'll use this reacher, show you a little different option. Again, we're going to start with the surgical leg. I'm going to keep myself reclined. It's important that you try and get it up as high as you can and get your foot through the end of the pants. Okay, we don't have to get it up over the hip yet because we're going to have to drop it back down to do the other side. But that was my surgical side. So now this side is not repaired. So I should be able to do a little lifting there to make it a little easier. That's why you start with your surgical. And then we're going to finish. Do not stand before your feet have exited the bottom of your pants, because you will step on your pants and make it impossible to pull them up over your hips. So again, I've got my my walker in front of me here. I'm going to push up from the bed. Stand up and safely apply my pants over my hips. Very nice. Okay, now we need to do our socks. So we're going to grab our sock aid here. The traditional way to do this is to apply pressure between your knees to put the sock aid. This may be uncomfortable for you if you're recovering from a recent hip replacement, so you can simply set it on your lap like this. I'm going to go with a taller sock here. We're going to take the sock. We're going to set this here. You're going to apply the sock over the sock aid so that the bottom of the sock, which would be the bottom of your foot, is going to go on the solid surface of the sock aid. We're going to pull it down. It's very important that you pull your sock as close to the tip as you can. So see how the black tip of my sock is right over the end of the sock aid. I'm going to pull up my pant leg a little bit so you can see what it looks like when it goes on. You're going to grab these nice big handles. This one came with beautiful big foam handles, which I like a lot. Continue to lean back slightly. Guide it over your foot. Simply pull it into position. Nice and easy. Now, you do have options with the other leg. So this was my hypothetical surgical limb. So post-surgical limb. So with the other leg, if you have good flexibility at this joint, you can cross your leg over and dress it in that way. But it's very important that you know you can't do that with the other leg. The surgical leg has to stay down. So for this one, I'm going to pretend I have good. As long as I stay beyond 90 on this side, I can pull the sock on in the traditional way without the sock aid on my non-surgical leg. okay? So next, we're gonna use our long shoe horn, this Juvo one here, to pop on a pair of shoes, okay? This is a really nice one. This grippy end is actually meant to help kind of guide your shoe into position. See there? Again, maintaining that 90-degree or greater hip. I'm going to slide my foot on, putting the back of my heel onto the actual shoe horn. I'm twisting my foot. Don't do that if you have a hip replacement. I want you to be able to see where the shoe horn is. I've got the shoe horn into the back of the shoe, and I'm going to use that to guide my foot down and in. Just like that. And because this is a nice stretchy shoe, I'm able to guide it in. This is a pretty thick sock. I wouldn't recommend going with such a thick sock because it's hard to get them into your shoes. So then I would grab my other one. Again, you can use the grippy side of this. Get it into position. Okay. You're going to flip the shoe horn around. Place your heel onto the slide portion and simply guide your foot in. The same procedure would go if you had selected a tennis shoe or a different type of shoe, just making sure that you use that shoe horn to guide your heel in so you're not stepping on the heel of your shoe so your foot goes in nice and comfortably. All right, so we are fully dressed now. We can go about our business very comfortably. I'm going to make links down below to all the equipment I've demonstrated with here today. If you have any questions or comments, please feel free to leave them down below. And as always, if you need more information on how to stay safe and independent in your home and community, consider subscribing to EquipMeOT. Thank you.